Good morning, everyone. First, I wanted to introduce myself. My name is Richard Russell. I am the newly appointed Executive Director, and I will be presenting to the Board of Directors today, August 13th, regarding Healthy Community Brookfield 2019. A brief outline, an introduction of HCB and the overview of an organization, the SWOT analysis, our missions and values, old and revised, our environmental factors, key strategies and action plans, and evaluation. Some of our goals: to present current issues and action plans to improve Healthy Community Brookfield. We need to increase transparency and educate staff, community members, and stakeholders. We need to revisit our missions and values while integrating them into our daily work ethic, and we need to address areas of improvement. A brief overview of the organization. Just a little bit of history for all of you guys. Even though you've been serving for many years, it's nice to do this. As you know, Healthy Community Brookfield is a 501(c) nonprofit or charitable organization that serves about 85,000 people in Brookfield County. It was originally founded as the VNA, or the Visiting Nurses Association. Since that founding, HCB has branched out into various sectors, such as preventative care, women's health services, tobacco cessation, and diabetic management. Currently, there are 97 employees that make up HCB. Well, 98 currently now. And funding is a concern, as we have not met the 9 requirements by the Public Health Accreditation Board. This impacts our services greatly. There's also quite a bit of confusion about who we are and what we do for our community, not only from staff, but the community itself. Some of these environmental factors that are impacting HCB. Like I said, we have a community that is unsure of what we do exactly and who we are serving. There is much cloudiness surrounding our mission and vision to those that live in Brookfield County. There are economic factors, including us losing funding or potential funding for services from the Public Health Accreditation Board. This impacts our programs immensely. Then the relationships that we have with our community are generally fair. They see us as doing well. They see us providing services, but our missions are not well known. Our vision is not well known. This again influences stakeholder and community involvement, and there may be trust issues associated with that. Our employees are unsure of their current roles, and they feel that there is a hierarchy of personnel. We need to work more at being transparent with our staff to improve morale and their commitment. So I performed a SWOT analysis, and our strengths, we have many strengths. We've got excellent trained medical staff, which include physicians, registered nurses, nurse practitioners, medical assistants, and social workers. Another positive part of HCB is that we are privately owned and that we are not owned or under any other organizations. You, as the board of directors, have a lot of power here at HCB, and it's reassuring to know that we are our own entity, and we should all feel very, very good about that. HCB provides services and programs, like I said, and as the new executive director, I vowed to complete a thorough situational analysis of this company. Some of our weaknesses: we're lacking structure. That's a huge component of it. We have a lot of people that are unsure of what they do in our services provided. We also have poor marketing. Unfortunately, I'm sorry to say that, but we do. We have a community that does not know who we are, our missions and our values. We have dwindling funding. We did have that $2 million that was generously donated, but those fundings, they've completely been spent. So we rely heavily on grants. We need adequate and transparent representation of our services and programs offered. This can actually help with donors also. And we have a lack of understanding from staff and the community regarding our expectations and our goals. But we also have many opportunities. Excuse me. We have a diverse group of employees that range from medically trained personnel to executives to community outreach workers. We also are in various locations throughout Brookfield County. We're in hospitals. We've got clinics, free screening sessions at local YMCAs, schools, and health departments. Another thing that I would like to focus on is not just having us be at schools and YMCAs. We need to go to areas where our community is very present. We need to go to the grocery stores, the doctor's offices, CVS, Walgreens, state fairs, county fairs. We need to come to the people and have free screenings and explain our services. We can't just expect everybody in the community to come to us. Another opportunity is to restructure the HCB. And with the newly appointed executive director, myself, that is my number one goal. And I'm going to delve deep into compliance issues, which may uncover areas of improvement. Some of our threats. Obviously, we have a regulatory issue as we did not meet the local health department's accreditation measures, which impact funding for those programs. Our employees are not fully vested due to perceived hierarchy of staff and the unpredictability of funding. That impacts their employment status and their security. It also impacts their well-being and their psychosocial health here at work. We have to think about how vested are our employees if they are concerned that they might not have a job in 6 months or a year. Our prime stakeholders question the overall mission of HCB. That is not good. We need to be seeking grants and funding that align with specific programs, not just being completely concerned with obtaining all of the money and funding that we can get and then dispersing them to what programs we think they're supposed to go to. We need to develop exactly how many programs we need. Are they desired within the community? Is there a need? And then we need to seek out grants and funding for specific programs. We may get a lot more money than we think. So our current and revised mission and values. I did take it upon myself to revise these simply because they are the original mission and values. And I think if we want to rebrand ourselves, then we need to update this because frankly, the other ones were a little bit too wordy and slightly convoluted. So the previous mission statement was, as a nonprofit organization, Healthy Community Brookfield serves to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. I made it basically a one-word sentence. It's very concise, and it's Healthy Community Brookfield offers health services to its residents and invests in their future by providing trustworthy preventative care. I feel that by offering trustworthy preventative care, that might help our community with our transparency. Our vision statement, our previous one, was as a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. Again, that's very wordy. So the new vision is Healthy Community Brookfield envisions a community where its residents' health and well-being are the top priority. The revised mission and values is concise. It incorporates both the present and future tenses, which is very important. And this transparency can aid in not only donations and monetary contributions, but also educates the public on what our ultimate goal is for the residents of Brookfield County. So we've got 3 strategies. The first one is to utilize evidence-based programs such as Healthy People 2020, or very soon it's going to be Healthy People 3030, to create a framework of goals for the Brookfield community. We need to start surveying staff on job satisfaction, areas of improvement to aid in retention and a better understanding of their roles. This may assist with that hierarchy misconception. And the main one is we need to address the fallouts and deficiencies reported by the Public Health Accreditation Board. So our action plan. We need to create a survey for onboarding new staff, evaluating current staff periodically, and also with an exit interview. We need to investigate where each deficiency lies as reported by the Public Health Board and develop tactics to rectify each situation and fallout, and incorporate evidence-based programs to serve our community. Human resources, they would be providing surveys on satisfaction to employees. They should be monitored every 6 months for trending. The Public Health Accreditation Board has provided us with every area we need to correct, and in doing this, an action plan for each deficiency will be created by myself and the manager of each department. And the Healthy People 2020-2030 framework will be our goals, and they will be assessed annually. So in order to measure how successful we are as a non-for-profit, we need to have goals, we need to measure them, and then we need to evaluate them. And we're currently not doing that. And we need to be utilizing evidence-based programs such as the Healthy People to create that framework. Some of our barriers and mitigation, we will have barriers and pushback. That's to be expected. And the best we can do is be prepared for those. Financial barriers are the greatest concern, as we did not currently meet those accreditation standards, and we're looking to be defunded for some of our services. Stakeholders may not be open to new changes simply because they are new, and this is where presenting our new mission and values will facilitate a better understanding. Also, letting them know what our new goals are. And all stakeholders will be kept abreast of situations as they arise, and they'll be presented with data collected monthly. A program's success is measurable, but only by collecting the right data and reporting it accurately. Employee satisfaction will be gathered and evaluated every 6 months, and action plans for the deficiencies from the PHAB will be reviewed monthly until the next reevaluation by the PHAB. These metrics will be gathered by managers of each discipline. And after 1 year of utilizing the evidence-based programs, aligning with the Healthy People 2020 or 2030, we will gather data and compare with previous years. And special items to pay attention to are tobacco cessation rates, diabetic care, diabetes, and premature births. All of those actually are funded currently by the Public Health Accreditation Board, so it's extremely important that we rectify those deficiencies. So in conclusion, I want to thank you for this opportunity to serve as your new executive director. And the board of directors is integral to the HCB's success, and without strong stakeholder support, HCB's new mission and values may not come to fruition. With proper situational analysis, compliance with PHAB's measures, and the improved community outreach program, HCB will be a success. And it's important the board of directors is innovative and also forward-thinking for the rest of Brookfield County. Together, we can improve our community's well-being for generations to come. Thank you.